Good afternoon, everyone. This is Helly Lee with the Center for Law and Social Policy. We're glad that you can all join us this afternoon. Just before we get started, I just wanted to give you all a couple of notes on housekeeping items. All of the lines that you're calling from are muted today, just to minimize some of the background noise that we may be receiving. So all the lines are muted. However, if you have questions that throughout the webinar, either for the presenters or for us as organizers, you are free to ask them through the bubble chat box on your screen. It looks like a little chat box that should be on the right of your screen, and if you click that, you can ask a question. That is also the method by which we will be collecting questions this afternoon. So if you have questions on the presentation or for the presenters, please also use that chat box. We will have a question and answer session at the end of the presentation. If we don't get to your question, we will be keeping a copy of all of the questions that are asked in the chat box, and we will do a follow-up with answers on a question and answers document that we will send to all of those who have joined us today. I also want to note that this webinar is being recorded, and we will be posting it up online, as well as the presentation, the PowerPoint slides from today will be posted online after the webinar. So without further ado, I will pass it over to Andy Stettner, who will lead us in this webinar.
So welcome, everyone. Thanks so much for making the time and being with us today, and thanks to Helly. I'm Andy Stettner. I'm the Chief Program Officer at Single Stop USA, which is a national organization focusing on streamlined access to benefits and services. And we're one of the conveners of the Coalition for Access and Opportunity, which is the host of today's webinar. And the Coalition is a unique collaboration of researchers, practitioners, and policy advocates, all focused on the key issue of coordination between programs. Really focus on strengthening the systems by which low-income families can get a suite of services that can help them have a springboard to opportunity. And since the Coalition started in 2010, worked on a number of federal policy issues, and then has been really excited to see how much has happened on the state level to promote integration of multiple services, and this year has hosted a series of webinars to help state advocates who are working to accomplish integration in their states and in their regions. And today's topic is, right at the heart of that effort, a very exciting work that has gone on through the Work Support Strategies program to really take the vision of practitioners and advocates who've been helping to streamline access and really have it be part and parcel of the way state agencies do business. And we will have additional webinars. We have a listserv and a website for advocates. We encourage you to contact us to stay involved and stay updated on what's happening with the Coalition. And we're going to turn over to Samiri and our other great speakers today who will guide you through this really important content, and hope we will be in continued contact with you all.
Thank you, Andrew. Hi, everyone. My name is Samiri James. I'm the Deputy Director of Work Support Strategies. I'll be presenting today representing the WSS National Team. Our goals for the webinar today, as Andrew said, we want to share lessons for advocates from the work from WSS that we've done partnering with states to increase access and to improve program integration. And so I'll start out by giving some background, answer the question, what is WSS? What are lessons that the national team wants to share with advocates? But then I'm most excited that Laurie Harvey and Stephanie Geller, that are both advocates from WSS states, will be talking about how they've been involved in the Work Support Strategies projects in their states. And so they'll be presenting second and third. So the question, what is WSS? The Work Support Strategies initiative is a multi-state initiative to simplify and integrate how states deliver the large work support programs, Medicaid, SNAP, and child care assistance. It's partnering with health and human service organizations at the state level. As Andrew said, we're excited we're excited about what can be done with state agencies to improve access. And we're working towards 3 goals. We want to ensure that families get and keep work support benefits. We want to ensure that state benefits are delivered more efficiently and effectively. And then we want to share what we learned, which is what we're doing today. The national team for WSS consists of 5 funders, the Ford Foundation being the leading funder, and NEKC, Kresge, JP Morgan Chase also provides support. Project management is a collaboration, and technical assistance is provided in collaboration between CLASS, the Urban Institute, and the Center on Budget. The 6 states that are participating in work support strategies are Colorado, Idaho, Illinois, North Carolina, South Carolina, and Rhode Island. So this slide tells you more about the data and what the picture looks like for families across the U.S. 35% of eligible parents aren't receiving Medicaid. They're not covered with the health insurance that they could get through Medicaid. 35% of eligible poor working families do not receive SNAP. And so this is giving you a picture of these low participation rates in individual programs, also highlight the fact that very few families are getting the full package that they're eligible for, and that full package of benefits can really lift families, can stabilize their lives, and ensure that they have access to work, to food, to health insurance. And then we've also noticed that these participation rates vary by state, and that's something that really got our funders involved in wanting to give funding directly to state agencies, because we can see that some agencies are getting it right. They are implementing program integration and things that make sure that families can gain access to these programs easily. And so we wanted to explore what can states do and with some funding and some technical assistance. Okay, so the next slide about kind of why the funders and our states really got involved in WSS. I think that responsive government is a widely shared value between states, and we have states of different political environments that are involved in WSS, and that the full package of benefits really helps families meet their needs, and in many states, their state policies, processes, and systems have become a barrier, and state agencies want to address those barriers and have gotten involved with WSS for that reason. Oh, too far. So what I wanted to cover next was the activities that states are involved in to address some of the barriers for customers. So, and for each of these, we'll talk about how advocates can get involved in business processes, in policy, in technology, data, and management. But in each of these areas, our states they're examining their business processes, which means they're looking at what happens when a customer walks through the door for their county or community office and what happens in that process of applying that is causing delays for the customer, and they're trying to come up with solutions and implementing some solutions around their local office practices. They're also looking at policies. Can they align redeterminations across programs? How can you align policies across programs to create less duplication for families? They're looking at their technology. ACA presents a huge opportunity for sweeping technology reforms, and they're making updates to their eligibility systems. And then with data, they're using data to identify and improve services and to see where is our cross-participation lacking. Do we have a lot of customers who are getting access to SNAP that we know are eligible for Medicaid and they're not receiving it, or families that have access to child care assistance but they are not getting SNAP and we know that they're eligible? So we want them to be looking at data too. And then in management and communications, WSS states have used the funding to bring in project management staff and to train train on those soft skills. A lot of our states have experienced budget cuts in the last few years, and the types of training and skills that are cut are sometimes those management and leadership trainings that are really important to having a state system that operates well and is responsive to customers' needs. Those are the types of training that are sometimes cut first, and WSS states have used that funding and the technical assistance to build back up some of their training and management. And so my first key lesson for advocates is about meeting families' needs. So we've just seen in states that we need our state agencies to work across their silos. We need our health and human services agencies to come together. And as we're thinking about that, I started to think that our advocates also need to work across the silos, that both health and human services are essential to families. We don't want to see a parent have food insecurity, and they have the food and they have the health insurance, they have SNAP and Medicaid, but they lose their job because of unreliable child care, or they're worried about leaving their child in a safe environment for their development and for their child's safety. And so having access to that full package is very powerful for our customers' lives. And as we've seen that government agencies aligning policy and practice across silos, we've also seen that advocates need to know about the different areas, and they need to be able to make those connections in order to advocate for programs being more interconnected. Okay. And then the next slide is that we want to make sure that another lesson is the power of advocates partnering with state agencies. And Stephanie and Laurie will make this point, I think, much more clearly, but I just wanted to say that, you know, you may be working with states, you may be in a state with different political environments and may not feel empowered to put out a message about increasing the number of people that get public benefits. WSS states are working in different environments, and they use messages that resonate with their leaders. For example, in Colorado, they have a little slogan that says that we want to be in time instead of on time. We want to be in time to meet customers' needs instead of being on time to be compliant. And compliance for SNAP is 30 days, and that's too long for someone to go being hungry. In Idaho, they make the point that government inefficiency shouldn't get in the way of families working, that families should not have to take multiple days off of work, have to have hours in the waiting room, calling the office and repeatedly in order to ensure that they get their benefits. And that's the message that different states are using. Another key point is to bring examples from other states to your state agencies. So you want to facilitate learning. We've learned from WSS states that site visits and peer exchanges really teach states what's possible. In times when they're struggling with their budgets, they can see what other states are doing and see what's possible. So if your neighboring state is doing something beneficial, if you're seeing learning opportunities between states, that's another opportunity for you as an advocate. And then you also want to take advantage of conferences and learning activities. Is there a conference that you're attending that you want to make sure your state agency staff can also attend? And that's something that you can also bring to your states. And then, sorry, I'm having a bit of an issue clicking through the slides. So our other lessons that I wanted to talk about were specifically around policy. I think I skipped a slide. So the policy lessons I wanted to highlight were some things that states are doing to reduce duplication. So we don't want customers submitting the same information over and over. We don't want them to, if we have their information for a SNAP case and we know that they're eligible for Medicaid, why are we having the family submit that data over and over or submit multiple applications? And then a customer, the states have also reduced the length and complexity of some of their applications, and Laurie will talk more about that for Colorado. And then one key lesson for advocates was also paying attention not only to the applications and if there are delays in applications, but also paying attention to redetermination, that we want to make sure families both get and keep the benefits over time, and if a customer is having a problem with reapplying, that'll be an issue also that, that advocates can get involved in. Then I apologize for the pauses, just having a bit of an issue clicking to the next slide. So the next slide is about express lane eligibility, and this is quite a few states have been able to enroll thousands of customers onto Medicaid using their SNAP information. And if you can just look up more information about this, I know this is something that South Carolina and Illinois have both been successful in doing and brought in thousands, tens of thousands of customers into Medicaid using their SNAP. North Carolina has used SNAP income information for customers applying for child care so that they don't have to resubmit their check stubs or their work information. And then in Idaho, they've been able to use the information they already have, the data matches they already have, information they have from the customer in electronic matches to redetermine some of their customers. So some of their Medicaid customers, they're not having to interfere with the customer's lives. They can check to see if their work status has not changed or their income hasn't changed. They can check that electronically without the caseworker or the customer having to spend time on it. And then also make sure as advocates that you ask for data, that you are staying vigilant, you're continually reviewing your data, setting goals, and ask the state to share that data with you. And ask them what it means, cross-participation data. What percentage of your SNAP customers that are eligible for Medicaid are actually receiving Medicaid? What's the plan for making sure that we enroll those people into Medicaid and SNAP? And then lastly, in the midst of ACA, there are opportunities, both opportunities and challenges that I just wanted to highlight. Stephanie and Laurie will touch on these, so I won't spend too much time on this slide. But one opportunity I wanted to highlight was the opportunity to reflect policy knowledge. So if you're seeing as an advocate that caseworkers and managers on the front lines in local offices, although they're working hard, they may need to build some of their policy knowledge. There's a lot of training going on around ACA, and this is a good time to bring to the state an opportunity that you'll have to say, these are some areas that we think additional training would be helpful. And then one challenge that I wanted to highlight, again, Stephanie and Laurie will talk more about it, is under new technology, that the second bullet, new technology and weaker, inconsistent business processes can lead to unpredictable failures along the way. And so states are dealing with implementing tough new systems, and if you have 100 counties in your state and you're needing to train 100 different counties on how to use a new technology, on how to change their daily operations based on that new technology, if you have 100 states that have 100 ways of doing things, or 100 counties have 100 ways of doing things, the amount of training that it takes in order to adjust to a new technology, our states are learning, is 10 times, 20 times what they expected. So with that as my last lesson, I will go ahead and pass control over to Laurie Harvey from Colorado.
Well, yes, good morning. I'm Laurie, and I'm the executive director of an organization that's a nonprofit and a community-based program here, working with TANF, the TANF single-parent population, since welfare reform in the late 90s, but we are a 32-year-old organization that has been working with single parents throughout these last 3 decades. And I've been involved with advocacy and policy concerning workforce and poverty for over 25 years with both state and counties, and was involved with our workforce support strategies coordinating committee working with our efforts here since 2011, and was so pleased that Colorado is one of the few states that was able to begin this project back in 2011. I'm also a part of a unique advocacy organization here in Colorado called the AFDC Coalition, All Families Deserve a Chance. It's an organization that's been around, a coalition for 20 years, and we're advocating for the interests of vulnerable and low-income individuals and families. And it's been so great to have a coalition that can work with the state and organizations like and efforts like the work support strategies. So we're bringing, the AFDC Coalition brings a diverse perspective of both advocacy and direct service, working together as partners. And this is very important in Colorado. Colorado is one of 13 states that has actually devolved the administration of not only TANF, but also SNAP, Child Care, and Medicaid. They have devolved that responsibility to the counties. So the counties administer those 4 programs here in Colorado, and the State Department of Human Services only has a supervisory role. So we have 64 counties, and yes, we do actually have 64 different TANF programs in Colorado. And by that I mean there's some things that are basically the same, but there are several things that are very different in each county, such as the child care threshold. And in the metro areas, we have people moving from county to county to get a better benefit in another county. So it's been very important for us here in Colorado to have this work support strategies at the state level. The coalition, the advocacy coalitions, I think, have had a strong voice. We've been part of state agencies, attending our meetings, events. They've invited our membership to participate in rules committees at the state, policy committees, and the voice of advocates, as you all know, is so important to bring that honest debate about issues that are harming customers as well as issues that are helping our customers. So working across those health and human services silos and representing all facets of human services. I just am making a quick pitch here that if you aren't, and it sounds like everyone here is pretty much involved with advocacy, but as a direct service organization myself, primarily doing workforce education and training, a lot of my peers haven't found themselves at the advocate table and just don't feel that there's going to be a good return for them. And I just believe not only is there a high return for customers, but also it's just as important as that fundraising and program development. And I, as executive director, find as much time to advocate as I do to raise funds for my program. And many times those things can merge together in conversations. Certainly, we have here in Colorado also a legislative task force over the past 4 years called the Poverty Reduction Economic Opportunity Task Force that identified several bills and issues that we were able to pass. Work support strategies helped along the way with this as well. We were able to eliminate the face-to-face interviews for TANF. Now those TANF applications can happen by a phone interview. That actually had to be a piece of legislation, amazingly enough. And we also last year had 3 very good child care pieces of legislation that were dealing with the cliff effect as participants earn more money and transition off of government supports. Often they lose all of their benefits at once, especially if they're getting a raise. So we had a series of 3 child care bills last year. One specifically is allowing the parents to gradually grow their co-payment after they have gotten a job. So it will increase over time so that they are not going to reach that cliff. And this is something that our coalitions have been working on for several years, and we had some great wins in child care this past year. I do want to just go through some of the specific accomplishments and challenges of the work support strategies. And our work support strategies has a coordinating committee and it has 4 work groups. The groups are family well-being, administrative efficiencies, access to benefits, and messaging and outreach. And of course, the state departments that are involved are both our Department of Human Services as well as our Department of Health Care, Policy, and Financing. The wins, and this was something that was just mentioned a little bit earlier, we have been able to streamline the application of public benefits going from 26 pages down to, it started out down to 8. Unfortunately, about a couple pages got added back. So it may be from 26 to about 12 pages, which is a huge savings for our customers. We've had a large emphasis on processing timeliness. You heard the slogan here in Colorado, in time, on time, and the work support strategy set a goal, a far-reaching goal, that at the end of the 3rd year, we would have 90% of our applications be processed in 7 days or less. And remarkably, we have hit that goal. For example, Denver County, which our largest county, had been processing individual cases taking a full 45 days to process, had a large backlog. This year, they are processing about some months 80% of their applications in the same day. And that's just remarkable. Our participants are leaving the county office with their benefits on their electronic benefits card, as well as their Medicaid in place. And many of the participants actually don't even believe it. They're just so surprised that they're able to get their benefits in one day. We've also worked a lot with the business process engineering and redesign, which did allow these changes to happen, and trying to have fewer touches on each case. And another slogan, I think, is you need to really slow down to speed up and look at things like we have been able to align redeterminations across all programs. They now all align to the SNAP timeframe, so participants don't have to go in and apply for Medicaid at one time of the year and TANF at another, and so they're all aligning at once. We've also done an interesting thing of mapping poverty and benefits across the state using census tracts. So we were able to look across the state and say, by census tract, are people receiving SNAP benefits in that county? And where they are not receiving benefits, but it looks like they should be, we have shared that information with some of the food insecurity advocacy programs who are now going to do specialized outreach in those areas. And as was spoken before, the technology to do all of these things is very difficult. We've had a system here in Colorado that is a state human services combined benefits management system, is our computer system. And it has, in the advocacy committee, not a very good standing. We've had lots of problems with it. Our participants have had lots of problems with it over the years. But I think finally, through conversations that the work support strategies was able to help with, is you cannot always just scrap something that the state spent millions of dollars on. And so we have worked together to create an oversight plan for this computer system across departments. The legislators last year approved a large infusion of general funds to upgrade and enhance this system. And of course, we're continuing to monitor it, but I think when you look at things like technology, they're so critical to things really working, but you also have to just not say, we want to throw the whole thing out, which we did say many times, but in the end, we decided that it was much more cost-effective to try to fix and continue to work with the state. We are, I think, as we have said many times, and I know Stephanie will say this as well, breaking down those silos across the state departments as well as within each department has been a big part of what the work support strategies has done. They are improving, and we are improving, I think, the lives of these low-income families that we're working with every day. And if we didn't have work support strategies, it would be very piecemeal, very fragmented. It's allowed us to not only coordinate the work, but also track the outcomes. And we've been conducting regional forums over this past summer across the state, talking to counties, customers, and the customers have said that the services and accessing benefits is getting better for families, and I know that that is a direct result of the work that we have done with our work support strategies. So I will move this now to Stephanie, and she is going to be speaking for the next about 15 minutes. Thank you.
Thanks, Laurie. This is Stephanie Geller. I'm a policy analyst at Rhode Island Kids Count. We are a children's policy research and advocacy organization, a statewide organization. And we've been involved with the WSS, or Work Support Strategies program, for quite a while. Actually, before this grant opportunity came up, we were part of a large group that had been pulled together by our local United Way that was looking at best practices across the country in terms of online benefit portals and other strategies to increase access to benefits. And then this eventually kind of morphed into a project called the Modernization Initiative, which was led by our former Secretary of the Executive Office of Health and Human Services, who looked at some of the work we'd been doing together with United Way on examining best practices in other states and started formalizing this process. Then in 2010, we saw this wonderful opportunity in terms of this grant from the Ford Foundation to work in collaboration with the state to increase access to work supports. And actually, some of the advocates in the state were actually instrumental in making sure that the state saw that opportunity and really encouraged the state to apply and actually helped with the application process. And then Rhode Island Kids Count, along with a number of other organizations, in particular the Economic Progress Institute, has been an ongoing partner with the state in implementing the Work Support Strategies project. We've been involved at the leadership table during the planning year, as well as during the implementation project, involved in committees and working together all along the way. There have also been a number of other groups that have been involved in terms of advocacy groups and direct service organizations that have been highly involved in working in collaboration with the state. Two new groups were developed as part of the Work Support Strategies project. Those two new groups were the leadership team and the advisory team. The leadership team was primarily made up of representatives from the Department of Human Services, but also included representatives from Rhode Island Kids Count and the Economic Progress Institute. And then there was a larger advisory team that was put together that included key stakeholders from within government, as well as direct service and advocacy organizations across the state. I also think it's important to note that there were a lot of existing advisory groups made up of direct service organizations, advocacy groups, policy groups, that were already involved and working collaboratively with the state in terms of pointing out problems that clients were having accessing benefits and working together to solve those challenges. And some of those groups are listed here on the slides. We had one specific to our TANF program called the Rhode Island Works Advisory Committee, one called the SNAP Advisory Committee, which is co-chaired by our SNAP Outreach Project Director and the state, Child Care Community Exchange focused on child care issues, Children and Family Consumer Advisory Committee, which is our health access group, and one involved with child support. It's also been, I think, both a success and a challenge along the way that we've had a change in administration during this process. While we were actually in the process of applying for the planning grant, we knew that the governor's term was ending, and I think it was really an important role that the advocates who were at the table played in terms of ensuring that there was continuity across administrations. In addition to the role that the advocates played, it was also important that those who were at the table and intimately involved with the work didn't just include those who were appointed, but also mid-career, sort of on director administrator level personnel working for the state, so that there wasn't a huge changeover in the people who are working intimately on this project. I also think that, just to reiterate the comments that were made at the beginning of the presentation, that there really the message of increasing access to work supports really does resonate across administrations, across the political continuum, really talking about streamlining access to work supports and reducing administrative burden both for families and state workers really resonates with all kinds of folks with different political persuasions. One of the key things that we think here at Rhode Island Kids Count that's really important to maintaining good relationships and in helping the state get things done on behalf of children and families is being viewed as not just an organization that finds things wrong or that criticizes work that's going on at the state, but that plays other roles as well. So, for example, we think it's important to sit together at the same table to help identify problems and point out when we know things aren't working, but then also to really roll up our sleeves and help solve the problem, working together in a collaborative way. Also, often we play a role of publicizing when the state is making policy and practice changes that are positive. Sometimes they're so busy doing the work of making these changes that they are not getting the word out to those on the street who are working directly with clients about some of these positive changes, and we've played that role. We also work with the state to identify policy changes that need to be made to improve access. Sometimes these might be legislative changes or regulatory changes, and sometimes these kind of changes can be most effectively be made from the inside by the state as part of the governor's budget or legislative proposals coming from the state, and sometimes it can be more effective if it comes from an outside entity like ourselves. Finally, I think it's important that advocates can be there really at the table to identify opportunities to receive funding and technical assistance like this work support strategies project funding, but also to do things like when our state received a penalty for a high error rate in SNAP, a number of advocates got together, in particular the SNAP Advisory Committee, to talk a lot about how we can use this, turn this around into a positive. We have to pay this money. We have to use the money to address the error rate. How can we do that in a way that both reduces the error and increases access? So looking for those kind of opportunities is really important. We also were involved in helping to make suggestions about who the larger group of folks should be at the table in terms of sitting on this larger advisory committee, recognizing that we need really to have a variety of voices at the table. So another major partner in this effort is the group I talked about before, the Economic Progress Institute, the other group that along with us sits at the leadership table. They are a nonpartisan research and policy organization really focused on improving the economic well-being of low-income and moderate-income Rhode Islanders. Another key group who's been involved is the SNAP Outreach Project. We've also had at the table the Community Access Program, or CAP agencies, as well as groups representing key populations, including the Center for Southeast Asians and Progreso Latino, groups representing the homeless, et cetera. And then philanthropy, the United Way has been very involved, and in particular their United Way 211 service has been involved. It can really talk about the daily calls they're getting from clients who are looking for, from families looking for assistance, what they're seeing as the problems that are on the horizon. And I think Laurie made a good point about this, but it's really important not just to have the usual folks who are going to the State House, who are at regulatory hearings, who are the policy organizations at the table, but also those who work directly with clients, helping them complete these applications, who get those phone calls about people having difficulty accessing benefits, who can help clients with language barriers or other barriers, and who can get information to the state about those obstacles that families are facing. Our group, much like Laurie described in Colorado, had a number of different groups working on different issues along with the state. We had 3 committees in the very beginning, one focused on policy, one on business process redesign, and one on data. The policy committee really worked in a number of different areas. First, we made up a kind of a little chart about what we saw as some policy changes that would really streamline access to benefits for families, and then tried to identify when these policies were required by federal law and when they were state policies that we could potentially change, either through legislative change, through rule or regulatory change, or simply through a change in practice. We also some of these changes we recommended, for example, some of which have been implemented, are increasing the child care eligibility period from 6 months to 12 months. We've been working on eliminating the $10,000 asset test for child care. We've also worked on the cliff effect issues around child care that Laurie talked about in Colorado, and have been successful in passing legislation on those issues in Rhode Island. And there's also been kind of a practice change that's happened, which has been a large number of families now able to access same-day SNAP benefits. We've also, a number of folks at the leadership table and in the larger community of advocates and direct service organizations have gotten an opportunity to review new paper and online applications, go through these applications, and provide feedback before they were finalized. There was also the data committee. And Rhode Island Kids Count, if you're familiar with other Kids Count organizations across the country, is really viewed as sort of the data organization in the state. We provide data on child well-being and want this data to be used to identify problems, make data-informed policy decisions, and ensure accountability and action. So we were very much at the table around what data ought to be collected and reported on a regular basis, what data could be used to identify problems with timeliness, problems such as families not receiving all the work supports for which they're eligible, and problems around churn or families staying on benefits when they were ready to be recertified. We also recommended that there be data collected and reported on a regular basis around the changes in policies and practices so we can understand the effectiveness of those changes. In particular, I wanted to say that the state actually developed a number of reports to look at the issue of churn, in particular churn around health care, SNAP, and child care, recognizing that there are a large number of families who are losing their benefits, perhaps only briefly for 30, 60, or 90 days, and then returning to the program because of problems with recertification in terms of because they're missing documentation, because their applications are lost briefly or held on someone's desk at the Department of Human Services, et cetera, and really looking at what practices can be put in place to reduce this extra work and stress both for families and for state workers. And some of the issues that have been put in place that try to address the churn issue are a new SNAP recertification unit, so a unit that's specifically focused on the recertification process, as well as what I talked about earlier, extending the recertification for child care assistance. And the last committee is the Business Process Committee. And we talked a lot about the as-is and the to-be. So as-is was really, what's the process look like now? And what do we want it to look like? And here our role was really a major role we played was to really advocate for the state to look to experts and bring these experts in to evaluate the problems of the current process and recommend changes. And Rhode Island was able to bring in several TA providers, including the Southern Institute, Change and Innovation, and CLASP, to help look at current processes and recommend changes in a number of programs. And Rhode Island Kids Count, the Economic Progress Institute, and other organizations helped identify the problems of the as-is process, and we also kind of try to keep our eye on the ball so that as changes are made in the business process redesign, we look for some potential unintended negative consequences when things are implemented that the state intends to be positive, like the same-day SNAP application. We make sure that it's not like a balloon or a bubble. When you press one side of it, another problem pops up the other side. So we're really trying to keep our eye on the ball in terms of that. And just to reiterate a point that was made earlier, it's really important to work across programs, in particular because nationally there's been quite a bit of attention paid to health reform, the Affordable Care Act, and a lot of energy paid in terms of developing new technology and new systems to ensure that that individuals and families get access to needed health care. But we need to make sure that during that process we don't see a drop-off in attention paid to other important human services programs. So some ways we've really focused on that issue is making sure that when that 90-10 money came up, those could be used to develop new technology and new systems focused on implementation of the ACA, that people were not purely focusing on healthcare, but were using that time and money focus to look at more broadly at the health and human service programs and how we can improve access to all of those. Again, I think we need to make sure that there are no negative consequences that happen as a result of making positive changes in one program that doesn't negatively affect others. We recognize that because so much attention has been paid to the ACA, that there's been a little bit less attention paid to other programs, and in fact, the early efforts to work on technology have been focused on healthcare. And so we're sort of working in an incremental way to get the online system to work primarily for healthcare now, but there's an incremental rollout set up so that the other programs will roll in over time. And we're going to be paying attention to that, not just Rhode Island Kids Count, but the other advocates who are at the table. And I am going to turn the ball back over just a moment.
Hi, this is C. Murray again. So I wanted to give some, I skipped one slide. I wanted to give some highlights that as Stephanie, Laurie, and myself were sharing our ideas and talking about this webinar, we were like, there's some key points we wanted to close with. So make sure you build relationships with your state agencies with a balanced approach, combining honest critique, very honest critique, but also bringing support also. And then also be active in technology reform as the point Laurie made about, this can be a very tough process for families and for advocates and also for the state in implementing those reforms. And so you want to be able to bring the reforms to the state early, but you also want to learn about the technology so that you can help families understand so that they don't lose benefits. And then implement a data strategy, but make sure it's a long-term strategy. It's not like a one-time meeting with the state about data. You want to be able to see data on a monthly basis, on a regular basis. You want to plan improvements and implement those improvements based on the data, and then review more data and plan more improvements and implement more. And then you want to make sure that you connect state staff with development opportunities. And I think this goes back to the point we were making about support, making sure that that your critique is also coupled with support for state staff. And then our biggest one was just working across those silos. Direct service organizations, we want to make sure that you're making time for policy and advocacy, and that policy and advocacy organizations are reaching out to direct service providers in order to pull their voices to the table, as Stephanie was saying they did in Rhode Island, and it's been powerful for them, that their direct service organizations probably can see first the issues that families are having, and they can give us an early alert, give state agencies an early alert of what's going on. And then one thing when we were talking, we also thought about was the fact that policy and advocacy and then your direct service and state agencies, sometimes they're in 3 different silos. And we want to make sure that we're trying to break down the silos between programs, but we also want to make sure that in policy, direct service, and state agencies, that those aren't siloed. And I think that's been a key message from this webinar, is that we have to have our advocacy organizations, our direct service, and our state agencies working together, because we're all have a role in meeting the needs of our customers. And so lastly, we're just ending, if I can get the mouse to move to the next slide, we'll end with Q&A. So please submit questions into the chat box that Helly spoke of earlier, and I am going to go ahead and answer one question. Is there any way to get details about the policy changes that have been made and suggested in WSS states? And we'll follow up this webinar with an email about with some resources. And sorry we didn't include a slide on resources. I was thinking about that. But we'll follow up with an email on WSS resources. And then we'll also include the link to the website. And then there was a question about who is in the AFDC coalition in Colorado. We can send out a list of who's in the coalition, but Laurie, do you want to just go ahead and say a few more words about that?
Yes, it is made up of a variety of both advocates like from the homeless programs, from housing, from food programs, low-income welfare to work type programs. So it's a great combination of direct services people as well as lobbyists from various organizations. So we could send you a little more information about that, and it just continues to grow over the years. So we'll get more info to you.
And
And then we also had a question about getting the Department of Education and the Department of Labor at the table for key partnerships for work supports. And I think that these are very good points, that these are types of agencies that need to be at the table that also kind of are siloed off. The idea behind work support strategies when the Ford Foundation brought it to class in the Urban Institute and the Center on Budget, they wanted to look at large programs where you have millions of customers eligible and how could changes in those programs really stabilize the lives of families. So, and one thing that we've also put on the table with work support strategy states is what are other agencies that you should be building relationships and communicating with. And so if in the process of having more connection between SNAP and Medicaid and child care, you also said we have our TANF customers. We need to make sure that we're reaching them. We need to make sure that we're reaching over to the Department of Education about child care. Those are other things that work support strategy states have identified and started to implement. We had a question to define ACA. So ACA is the Affordable Care Act, sometimes affectionately called Obamacare. And so states have been able to get a 90-10 match on improving their technology, not just for their Medicaid systems, but for their human services like their child welfare, SNAP, and their food assistance and their child care assistance programs could also be, technology improvements could also be covered under the Affordable Care Act. And then we had a question of, did any WSS group discuss child support pass-through or child support enforcement? And I think the answer is yes, but I would need to look up. So when we send an email about resources, I'll also make sure to answer this question about including more information about child support if any of the states did work on that. And then when will WSS start publishing comprehensive wins on these strategies? So we have key lessons from the first year. Like I said, we'll send that out over email. And then we will start to, we had a study, a brief that we just put out. We're doing a leadership study right now on what our states have learned about leadership. So there is a big part of the funding for WSS also went to evaluation to really have a rigorous evaluation of what we've learned in the different states and also on the data, what the data has shown has happened in each state. So we'll send out what we have so far, but we'll also make sure to keep you guys on the listserv as we have more results coming out from WSS. So we have 5 minutes left. We wanted to do a poll really quickly just to see, this helps us know how much you learned and how much you enjoyed the webinar, and also who we have on the call, if you guys don't mind helping us out with the poll. So I think you'll see the question pop up in just a second. So we're going to give everybody a minute to go ahead and get their answers in. I think everybody has put in their answers, and we'll move to the next question. Give us 1 second. And then you should see the second question come up now. And now we'll put up the third question up. It looks like a couple of people just answered. Okay. And then there was a question that I wanted to answer that came in through chat as you're answering your poll. I'll just talk about that. Is there any way to know what work is currently being done in your state? And I think the answer is, I think if you guys can just email maybe to Helly or to Elizabeth Lower-Bosch with Coalition on Access, what states you're in, I think, and we can answer back about what advocates are doing in your state and about what your state agency has been implementing around integrating health and human services. So that's definitely a question we can answer, and just let us know what state you're in. And then we're putting up one final question and for you, and then any more questions for us, just go ahead and put them into chat. Okay, well, thank you so much for participating in the poll, for everyone who's called in and listened. And as I said, if there are additional questions that you have for us, you can email them to Helly Lee or Elizabeth Lower Bosch. And the recording of the webinar will be posted so that you have the slides on the Coalition on Access website. Thank you so much for joining us. Have a good day, everyone.